welcome to this segment of 71 Magazine. I'm your host, Jaime Rafferty. With us today from the Green River District Health Department are Lisa Stanley and Suzanne Craig. Good morning, ladies. We're happy to have you.
Good morning.
What the audience doesn't know is that I've got two of my favorite people here with me today.
Likewise. Thank you.
No, thank you all. And what we're going to talk about today are the mission of the Green River District Health Department, the purpose, some things that you all do in the community. People may not be aware, so Suzanne, we're going to start with you and just dive right in.
Thank you. The health department, we do all kinds of services that people don't think about. If you've been to a restaurant in the last month, you can thank a health department because we inspected that restaurant and to keep the public safe. We do a myriad of services in the community, from home health services to home visitation nurturing programs to clinic services, cancer screening, WIC, a broad range of services that are going to protect and promote health in our community.
Absolutely. And having worked there myself for about 5 years, I'm extremely passionate about what's offered. I know immunizations.
Absolutely.
And I will say locally, WIC is huge for so many mothers and infants. And the promotion of that program locally, and that people are fed and nurtured and they're growing because of a program offered by the health department.
Absolutely.
Correct. Yeah, and you know, Lisa, I'm going to go right over to you. You're the maternal and child health coordinator, correct?
Right.
And so I'm sure this is something you're extremely passionate about.
Yes, yes. And we encourage all women of childbearing age, pregnant women, women that have babies or breastfeeding, and children up to the age of 5. A lot of women don't think they qualify, but we encourage them to come in or call the health department, their local health department, to see if they fall within the guidelines that they would be eligible to receive WIC benefits.
Sometimes we count ourselves out before we even know if we qualify or not.
I think some women are surprised that they actually qualify, and there are some amazing benefits nutritionally wise.
Well, and I'll tell you, it's come so far. I used to be a cashier, and from the WIC voucher to the cards and everything else, it has come so far as if you're a mother needing those services, you go in there and it's so much more streamlined than it used to be.
That is correct.
So that's a great positive. But Lisa, one of the things we want to talk to you about is this oral health initiative. As maternal and child health coordinator, you're really focusing on mothers and children.
Right.
And people do not understand the impact of oral health. And so tell us about this initiative and how it can benefit these children.
Well, we were very excited, and it is called the Oral Health Innovation Project. It's one of our new programs that we started at the health department through the availability of some grant funding that we received from the Kentucky Oral Health Program. So what we were charged with was we wanted parents, families to know the importance of good oral health care starting at an early age. So Suzanne and myself decided that first and second graders may be a good age to target initially. So what we wanted to do, we just didn't want to hand a child a toothbrush. We definitely wanted to incorporate the educational component. So we decided that one of the main causes of tooth decay is sugar.
Yeah.
So in fact, in our research, we found some facts out from the Kentucky Children's Oral Health Foundation that over 51 million school hours are lost each year due to dental pain. So this was extremely surprising to us. Also, tooth decay is the #1 most common chronic illness. It tops childhood obesity, asthma, and diabetes. So we were just shocked by these findings.
Yeah.
So that's another reason we decided to focus on the younger children, to catch them early. So hopefully it will develop a lifetime of good oral health habits.
And not just oral health. If you look at that sugar intake, you're also looking at other chronic diseases that could come.
That is absolutely correct. So in part of our mission and education component, as part of our lesson plan that we're doing, and let me say right off the bat, we've had some excellent partnerships with the local school systems, with our family, youth, and resource centers, and actually with the Henderson Community College also, and some of our community college families helping us get this important message across. But we incorporated a sugar component by actually teaching the children. We took some common products that children take into their diet every day, showed them how to calculate the sugar content, how to read labels. So for example, 4 grams of sugar equals 1 teaspoon of sugar. So we were amazed.
Wow.
So an average size juice box, a 6-ounce juice box, has 4 teaspoons of sugar.
Oh, good.
Right. And
wow.
we would never tell our children, Johnny, go get a spoon and
Eat sugar.
Yeah, eat 4 teaspoons of sugar.
So
So we do it accidentally. Right?
Yes, and that's true. And so many kids that we kind of just took a random poll, asked how many of you ingest like a soda pop each day? Every hand in the room went up.
Yeah.
Well, a 12-ounce soda pop has 11.5 teaspoons of sugar in it.
Oh, wow.
So part of our
Yeah,
lesson, we teach kids, we show them a video that just talks about the detrimental effects of sugar can have on their teeth. We also, in addition to the educational component, each child that we come in contact with gets a dental kit. And in that kit is a toothbrush, fluoride toothpaste, and floss. Also an educational sheet for parents for the child to take home and hopefully have a message about good oral health. But the most important thing, or the most thing we're excited with in this kit, and the kids absolutely love these, is a 2-minute brushing timer.
Oh, yeah, and it can be a competition too. If you've got a sibling, you want to.
Exactly.
Yeah.
So we encourage the kids to take those into the bathroom with them and to brush for 2 minutes, and they absolutely love that part. We also provide them a brushing chart that they can hang on their bathroom mirror to brush morning and night after sugary snacks. We also encourage them to visit their dentist at least twice a year.
And, you know, I think that just with anything, repetition is good. So if they start hearing it early and hearing it often, that becomes a part of their lifestyle.
Right. So hopefully they're taking that message home, not only improving their oral daily health habits, but also maybe hopefully making a change in their diet.
Absolutely.
And also that Kentucky ranks in the top 5 states with the citizens with the most missing teeth. So we're really trying to prevent that kind of outcome.
Sure.
And start with the children.
We want to be top 5 in something else,
That's
not
right.
in toothlessness
Correct.
or toothless. You know, I can see that timer being used for other things for parents, shower times, those types of
Right.
things. So that
Telephone time.
And that's right. That actually comes in handy.
Right.
But you know, so many of the, you know, you mentioned a while ago about qualification of services for WIC even.
Right.
You know, you all have a program also through the health department that people may need to utilize due to lack of other resources medically. Can you tell us a little bit about your program there, Suzanne?
Sure. That I'm representing Community Access Project today, and that I'm very passionate about this project because it really makes a meaningful difference in the community with helping people gain access to prescription assistance and other donated care. For example, over the last 10 years, we've been able to coordinate more than $40 million worth of donated care. So this is not a light
No.
kind of situation. We take this responsibility very serious. And we can't do it without the support of the medical community, Davis County Fiscal Court, the boards of health, the Davis County Boards of Health, and many others who believe in what we're doing and see the return on investment and see the good that it's doing to the community. So what this looks like on an everyday situation is that hardworking people, for no fault of their own, sometimes their insurance won't pay for their medicine, or it's not covered under their policy, or they don't have insurance. And so you end up with a very chronic condition like diabetes, MS, cancer, and a whole wide range of disease or conditions that you need medicine for. And so many people sometimes say, well, I didn't really think that there was help for me. And so there are more than 5,000 medicines that people can get for free and they don't know it, and that have all kinds of different income requirements. And so
You all do that hard work in finding out what those are. Did you say you work with the pharmaceutical companies?
we do. And so we, those 5,000 different programs through pharmaceutical companies, we research and find out what medicines that our clients can get for free. And we work with their physician or the nurse practitioner, whoever their medical provider is, and we fill out that paperwork and work with that provider so that that patient could get access to their medicine. And often when they're approved, they gain access for up to a year worth of medicine.
I know with a moment ago, Lisa referenced with WIC, making sure that someone calls in. Is that what you encourage, or do local physicians know about the CAP program in order to to send them, or does someone just need to call if they're watching today and they have a situation like you described?
Sure. They could absolutely call, or they could walk in, and we'll do our best to try to set them up with an appointment. But the number they would call would be the 270-852-2904. That's 852-2904, and that they could talk to a case manager who's going to be compassionate, who's not going to judge them, who's really going to they really embrace, the case managers are so wonderful, they really embrace the mission of public health. And so they often we have a philosophy that we leave everyone that comes in contact with us better than the way they came.
You found them, yeah.
Yeah, and so we welcome phone calls or visits to the department. We're located inside the health department here in Davis County.
Now, I want to ask, I know
Breckenridge.
oftentimes, I'm making an assumption, and you correct me if I'm wrong, do you see a lot of comorbidities? You coming in with people that have more, which to the audience, that means more than one thing going on at one time medically. Do you see that? Because I would think with diabetes comes a whole host of other issues.
Absolutely. It's very common to have hypertension with diabetes, or have, often that's the case, but sometimes it's just that people are trying to make their life better and they just have one diagnosis.
Sure.
But we often see multiple. And so we're often trying to connect them with other resources too in the community. So, we're not, we understand that our service alone is not the only service that promotes health and promotes quality of life. So we really take a case management approach when it comes to trying to help someone.
Well, I know, Lisa, one of the things that we do together, many of our viewers know that I also work with the Kentucky Cancer Program, but one of the things that the health department is really passionate about is community partnerships.
Absolutely.
To make sure. So can you tell our audience some of the committees that you all serve on, and coalitions, and the work that's being done there?
Okay, as part of the Green River District, we wanted to go in each community, and we did community health assessment plans where we actually went in and canvassed neighborhoods to ask the populations what they felt were the most important health issues facing their communities. So most of the communities chose access to care, obesity or lack of physical activity, and substance abuse as some of their three main goals. So we have 7 health coalitions in our communities. And most of these health coalitions chose these areas to focus on in subcommittees. So, and you're on several subcommittees also, but we're able as a smaller group to kind of really see what the problems are that those communities are facing, and to work, the small groups get together and work with other partners to help address those issues and hopefully make some improvements.
Well, and I think one of the things that, like, as you all are talking about the oral health and then going back to the CAT program as well, because of the partnerships that you all develop, you all are able to connect people to resources, and you're not an island anymore. Sometimes I think as organizations we feel like I'm only cancer, but when I come to these community meetings, I may have a person who is a cancer patient, but they're in need of prescription assistance, or they have children and they need to get that oral health. Mom is busy with a diagnosis and she needs to make sure that she's got a child in school who's getting those other health messages.
Right.
So it's been amazing, I think, how they kind of cross-pollinate.
Oh, the partnerships are invaluable, and it's just amazing how all the communities want to come together for better health for their communities.
Mm-hmm. And we remind people that the public health system includes the whole community.
Right.
Everything
Right.
from the hospital to Audubon to Grad to Kentucky Cancer Program, to a wide range, all of that safety net, that is public health. And so it's invaluable to our daily work. There's just no denying it.
Well, I think one of the things that you mentioned is that with oral health, it was a grant opportunity. I think sometimes people just automatically think, and my organization included, that we're just simply funded by our taxpayer dollars. But we're in a time now where so many services are needed, so many people are in such great need, that we're really blessed to have other opportunities to apply for funds to even go beyond the what's looked at as the normal scope of the work.
Right.
And really, the health department is very innovative and looking for different creative ways to meet those community needs. And so I can't say enough of how lucky we are to work for an organization that really tries to task us with finding the most creative, being the most resourceful way to really get the message out in the most cost-effective way.
And what you're seeing too is the age of, with you being maternal and child health, and then even the populations that are able to be served through your program. You're getting birth, you know, you're getting the gamut of ages that's being covered, hence public health, right?
Right.
One of the things that I think is so important about what you all do is that you all are a team. You all go out into the community as a cohesive group working for the greater good of the community. And I hope if people have any questions about your all's services, if they're not at these meetings that we're at, and maybe they're just watching the show and they didn't realize the vast array of what's offered, how can they get more information?
They can call the health department. Our number is 270-686-7744. And they can just tell whoever answers the phone what they're interested in. And we're open 8 to 4:30, Monday through Friday. And we're located at 1600 Breckenridge Street.
Well, I want to ask one final question, and Lisa, I'm going to direct this to you,
Okay.
just because she's working with children right now, and you cannot not ask this question. There are many shows on these days. One of them is a show about kids saying funny things and so forth. Are you seeing a great response for these kids with these toothbrushes? Are they excited? Are they?
They are extremely excited, and they're just so involved. And Suzanne and myself, we've been re-energized and encouraged by the children's, just their interest in this message. And then we go back, we're finding we've had a couple of children that maybe had gotten the message at school, and then we've gone to some other community organizations, and they are remembering everything that we've told them. So we are
Wow.
definitely encouraged by that.
I know, it keeps you going, doesn't it?
It absolutely
So
does.
we often do a two dance with them, and it's
A tooth
Suzanne
dance.
is wonderful at the two
A
dance.
tooth dance.
a two dance. So
A
it's
two
like
dance,
yeah,
okay.
you brush twice a day for at least 2 minutes, and you go to the dentist at least
Two times a year.
And so we'll put 2 in the air and we'll wiggle around, and it's pretty unsightly, but it's
Oh, this needs to go on YouTube, I'm just saying.
but it really helps them remember that, and it's really cute to be able to interact with the children that way.
Well, it sounds like I am missing the boat, and I need to come to one of these because I would be a two dancer. I'm positive of that.
You would be great at it.
I'd love
Yes.
it. Well, ladies, thank you so much for taking time out of your busy schedules and sharing all these wonderful programs that the Green River District Health Department offers.
Thank you for
very
having
much.
us.
And we'd like to thank you for watching our segment today. Please stay tuned for more great community programming here on OCTV Channel 71.
You brush twice a day for at least 2 minutes, and you go to the dentist at least
Two times a year.
And so we'll put 2 in the air and we'll wiggle around, and it's pretty unsightly, but it's
Oh, this needs to go on YouTube, I'm just saying.
but it really helps them remember that, and it's really cute to be able to interact with the children that way.
Well, it sounds like I am missing the boat, and I need to come to one of these because I would be a two dancer. I'm positive.